The holidays are around the corner, and many women are thinking about trying to be ready for the social gatherings and the new year. But even though putting on the little black dress is a goal for many, some women may be reluctant because of the appearance of varicose veins in their legs. You may be surprised to learn that as many as a third of women start developing varicose veins in their late 20s and early 30s. Fortunately, a McMaster University researcher has a solution that does not involve lasers or surgery. Joining me now today is Dr. Joseph Gabriel. Welcome to the program.
Thank you very much for having me.
Thanks for taking the time out to speak with me. Now, Dr. Gabriel, what interested you in doing research into varicose veins?
First of all, I started this research because I wanted to see if I can bring in natural molecules through the skin rather than taking them orally, so you can bypass all your stomach and your intestines when you take things orally, and you get to the root of the problem directly through the skin.
So now you're talking about it going through the skin. Now it makes me think about some of those creams that we women use for things like cellulite or wrinkles. How is this actually going to work and benefit women?
Okay, well, we have a delivery system. That's what we are. We're a delivery system technology where we found a way to bring in molecules target specifically through the skin. Now, those creams that you purchase in the stores, they just sit on the top or in the just above the epidermal layer. We can bring in our molecules deep down into the dermis and near the where the systemic or where the blood flow goes, and actually affect the blood flow for varicose veins. To actually get more blood flow going through that area, because when you have varicose veins, you have an inefficiency of the blood moving back to the heart from the lower extremities, like the legs. So what this cream does is it actually gets deep down, and it strengthens the capillary walls, and allows for more pressure or blood flow back to the heart, so you don't get this blood pooling and this look of purpleness in your lower extremities. After using the cream for multiple weeks, you'll actually see the varicose veins go away. You'll start to see that clearing of that purple. It'll go pink, and then eventually you won't see the color, those dark purple colors that people are annoyed of.
Okay. Now, I mean, you've gone into a lot of detail about how this product works, and so basically you're telling me how you developed it. Like, what gave you the idea to do this as opposed to an oral tablet?
Okay. So, as I said, the technology was developed because of a personal issue. My wife had developed a bone tumor in her cheek area of the face, and the surgeons took out the tumor. It was malignant and came back 3 times. On the 3rd time, they actually cut the nerve, the trigeminal nerve, and she developed what is known as neuropathic pain. And from there, the pain doctor, or the medical doctor that deals with pain management, had started giving her medications to control this pain, but she developed a lot of side effects, such as hypertension, gastrointestinal ulcer problems, rash, and so on. So at the time, the doctor said if she can't take the pills, which she was having issues with, could you develop a delivery system that we can bring them, mix the drug and mix it in with the cream and put it directly on the face and get to the area without going through the stomach and so on, like oral medications. And I did, and it worked, and then we started doing clinical trials, and from that delivery system we developed this cream known as a varicose veins cream, because it is a major problem in today's society with chronic chronic venous insufficiencies or blood flow issues in middle-aged people and in the elderly specifically.
Right. And I know I mentioned women, but it does happen to men as well. How quickly can somebody expect to see results from using this cream? Because you mentioned weeks. Do you have an average? Is it like 4 weeks, 6 weeks, 8 weeks?
So with our clinical trials, you actually feel relief right away because many people with varicose veins have pain associated with the varicose veins. So the pain will go away immediately within 20, 30 minutes.
Wow.
But the discoloration of the varicose veins, for example, it may take 10, 15 years to develop varicose veins. It's going to take a while for you to strengthen the capillary walls or the endothelial cells they're known as. So what we've done is made this cream with molecules that actually strengthen the capillary walls, and it usually takes 4 to 6 weeks to actually see the discoloration or the actual part that women don't like to look at to start to go away. But to answer your question, if for the short term, for pain management and for as an anti-inflammatory, it works immediately.
Okay. Now, are there any side effects from using this cream?
At this point, no. We haven't found any side effects. We've done clinical trials with the delivery system with various creams. With the varicose veins itself, varicose vein cream, we have not found any with thousands of patients that have tried the cream before we actually put it on the market. So no actual adverse effects because it doesn't go into the bloodstream. It actually hits the blood vessels and strengthens the walls of the blood vessels, so it doesn't get into the actual bloodstream.
Okay. Now, are there any natural ingredients in this, or is there something that you chemically formulated to create this cream?
No, this cream is a total natural cream. We use plant-derived molecules. In this particular cream, we use what is known as the bioflavonoid rutin, which you have in your which you consume in your diet through onions and citrus and so on. And what is also known as horse chestnut, which is there's a molecule known as eosin, and these two molecules, rutin and eosin, and another one known as witch hazel, actually help strengthen the capillary walls. So you get fragility in your blood vessels, and this actually strengthens them so you can get more blood flow.
Okay, that sounds very interesting. Now, your product is called LivRelief Varicose Cream.
Yes.
What are some of the tips that you would give to your clients as to what they should avoid in order to prevent varicose veins if they don't have them yet?
Well, the most common thing or the best gold standard is for women that have history of family members that have varicose veins is to start using what is known as compression garment. Which is compression stockings. Yeah, before they used to be very not very appealing, but now they have some really nice ones that you can hardly notice the difference, and it would get to the lowest mercury level type stocking. So it's exactly like the stockings you purchase, but they basically provide a little bit more compression to the leg, and it helps prevent this fragility of the blood vessels that allows for blood to flow. And also our LivRelief cream will help also as a prevention measure to use that product before you develop the varicose veins because it's totally natural. It won't create any long-term side effects. So basically compression garment, movement, exercise, and so on. If you use it, if you don't use it, you lose it. So if you keep movement you allow more blood flow to move from your lower extremities back to your heart. So so proper exercise, proper diet, and so on, and compression garment, and in combination with our creams.
Okay. Now, you mentioned that part of this idea of being formulated came from an unfortunate issue that your wife had. Has she personally tried this product at all?
Yes, actually, she has varicose veins from when we had when she had our children. Many women, through the stress of having children, pregnancy, develop these known as varicose and spider veins, and she noticed a significant difference after approximately 6 weeks of using the cream. The important part here is to make sure that is compliance, that you actually use it twice a day, and continue
twice a day.
it for and continue doing it for 4 to 6 weeks, and you will see a significant difference.
Okay, all right. Well, you've been very informative today and given us a lot of information to take in about LivRelief Varicose Cream. Where can our listeners actually go for more information if they want to purchase it for themselves?
Yeah, so you can go to our website. It's www.livrelief.com, and you can find it in all the pharmacies and natural product stores right across Canada.
That's great.
It's a wonderful product. I'm quite proud of it.
That's great. Well, thank you so much, Dr. Gabriel, for all the information you've given us and for giving me some of your time to talk about this new amazing product.
No, thank you for allowing me to share the information, and hopefully I wasn't too technical.
Oh, you gave us enough information that we needed. I think everybody understood what you were talking about, so thank you so much.
Thank you for talking to me. That's great.
No problem. Have a great day.
Thanks. Bye-bye.
Bye.